What does a muscular dystrophy muscle biopsy involve? Have you ever wondered what happens during a muscle biopsy for diagnosing muscular dystrophy? This important procedure helps doctors understand muscle health and identify specific disorders. Let's take a closer look at what it involves. First, a muscle biopsy is performed to obtain a small sample of muscle tissue. This sample is crucial for analyzing muscle structure and detecting any abnormalities that might indicate muscular dystrophy. The process begins with preparing the biopsy site. The skin is cleaned with an antiseptic solution to reduce the risk of infection. Next, local anesthesia is given to numb the area. This step is vital because it helps avoid pain during the procedure. The anesthesia does not penetrate the muscle itself, which is important to prevent contamination of the sample. Depending on the method chosen, the biopsy can be done in two main ways: an open biopsy or a needle biopsy. In an open biopsy, a small incision, usually about 3 to 5 centimeters long, is made along the direction of the muscle fibers. This technique minimizes damage to the surrounding tissue. The surgeon carefully exposes the muscle and removes a small piece for testing. Afterward, the incision is closed with sutures to minimize bleeding and bruising. On the other hand, a needle biopsy uses a special biopsy needle to extract a muscle tissue sample. This method involves minimal incision and can often be done with sedation or local anesthesia. Once the sample is collected, pressure is applied to the site to stop any bleeding, and a dressing is placed over the area. Patients are typically advised to rest and avoid strenuous activities for a few days to aid in healing. The muscle tissue sample is then preserved, often by flash freezing, to maintain its integrity for laboratory analysis. A pathologist who specializes in neuromuscular diseases examines the sample under a microscope. They use various staining techniques and tests to look for signs of muscle fiber degeneration, inflammation, or other changes that are characteristic of muscular dystrophy. In summary, a muscle biopsy is a vital diagnostic tool that provides direct evidence of muscle pathology. This information is essential for accurately diagnosing muscular dystrophy and determining the best management strategies. While the procedure is generally safe and discomfort is manageable, it is always best to consult with a healthcare professional for personalized advice and guidance.